Good morning, everyone, and welcome to the Candido County Board of Commissioners meeting for Tuesday, April 1st, 2025. Please stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Welcome everybody who's in the audience today, as well as the folks picking us up on YouTube. And April is National County Government Month, and I just want to thank all of our employees and my fellow commissioners, department heads, everybody who makes Candido County a great place to live, work, and play. So with that, the first item of business is the approval of the agenda.
Mr. Chair, I'll make a motion to approve the agenda.
Thank you, and is there a second?
I'll second it.
Thank you. Any discussion, questions? Hearing none, all in favor say aye.
Aye.
All opposed? Motion passes. And then the next item is the consent agenda. These include the approval of the March 18th, 2025 County Board legal minutes, the approval of the auditor's warrants and claims, paying the bills, 2025 liquor license renewals, approval of CD 46 Drainage Authority hearing for March 18th, 2025 minutes. There we go. And that read a little different. Wilmer Aerial Spraying Inc., permission to spray for tent worm caterpillars. And then the last item, Wilmer Y surplus property. This is an ag lease, ag land lease agreement, and this is a renewal of an existing agreement. Are there any of these items that commissioners wish to pull for further discussion?
Mr. Chair, I so move to approve the consent agenda.
Thank you, and a second?
I'll second that, Mr. Chair.
Thank you very much. Discussion? All in favor, say aye.
Aye.
All opposed? Motion passes. Thank you. First up on our agenda then this morning is Woodland Center's report. Dr. Ashley Chose, Chief Executive Officer.
Hi,
Dr.
everybody.
Chose, good morning.
Thank you. Thank you for having me here today. Did you all get this in your packet? Yes? Okay, if not, I have copies, so I just wanted to make sure you all had it. I am Ashley Chose. I'm the Executive Director at Woodland Centers. We like to come and just give an update, answer any questions you all have about mental health, about Woodland Centers. The first page in there is really just an overview of who we are. For folks that are not familiar with us, we are a private nonprofit entity. Our mission statement, we support all ages in finding hope and recovery. Our biggest reason why we're in our community is to help people form connections to transform their lives. And for Woodland Centers, those connections are really important. We know that 40% of recovery is about the connection you make with your provider. So it's not about the type of therapy you get or the type of service you get. It's about that connection and feeling like you're heard and understood. And so it's a big part of what we do is connecting with our clients, but it's also connecting with our community members. It's our partners. We can't do everything in the community, so how do we connect when people need housing supports, when they need food supports, when they need other types of supports in the community that maybe we don't provide, and helping our clients connect to those things. And so a big part of what we do are those connections and helping bridge what people need in our communities. The bottom are commitments. We really are in the business of saving lives. That's what we do every single day. It's really important to us to help bridge access and help people reduce those barriers to access, finding ways to help people have hope, have meaning in their lives, and that's really different for every individual that we serve. So again, if you're just not familiar with Woodland Centers, I wanted to give an overview of just a little bit of who we are and how we function in the community. The next page really talks about the services that we provided in 2024. So in 2024, you can see we served 4,762 individuals. It's down from 2023. 23 was an anomaly. We served over 5,300 people. It just was a huge bump for the year. I can't quite explain why that number went up so high. We're back kind of on that normal trajectory of increasing the number comparative over the years, but 23 was just a off year, in a good way. We had a lot of people. So the next column down there says the percentage of clients by county, so you can see how many people we're serving by each county. we having an issue? Sorry.
Sorry.
Oh, no, you're good. I just want to make sure if there was a problem, I was addressing.
you're-
it. Okay,
you're
okay,
fine, yes.
all right.
Thank you, Mr. Chair. I just had a question.
Yeah.
Could you lay this out on the overhead camera? That way it'll be on YouTube and people can
Oh.
see the graphs?
I don't know how to do
Trying
that.
to get it up here,
Okay,
so
Oh.
that's better, 'cause then it'll still show up.
okay.
Okay, I don't know how.
We're working on it.
Okay.
Yes, okay.
Okay,
Sorry to interrupt.
perfect. So yeah, that next one just shows by county. So you can see in Candioi County in 2024, of all the people we served, 36.25% of all people were from Candioi County. We did serve about 16% of our people were from non-catchment counties. We do have contracts with different counties to be able to do crisis services. People come in for all types of services across our area. So that they come in all over the place. We did serve, oh, go ahead. Did you have a,
If I can interrupt, just to let you
go ahead.
know, just to let you know it's up there.
does that help?
There, that's
Okay,
perfect.
perfect. We served 69 of Minnesota's counties last year. And so we do serve people from all over the state that come in and receive services. Some of that happens too because maybe they're living in one of our catchment counties, but their county of financial responsibility is outside of this region. And so we count them as being from a different county, even though they might be living here, like a group home scenario, something like that. We served people of all ages, so 3 to 87 last year, and 32% of all clients served were youth. That number continues to grow. In our mind, that's a good thing because hopefully we're serving people earlier at a younger age, doing more prevention, early intervention efforts. So the younger we can see people, the sooner we can see people, we feel like that's better for everybody involved. So it's a little bit about who we serve. The next page also talks about the ages that we served. So just breaks it down by different age ranges so you can see those different categories. We are seeing more of that 0 to 5 population. Last year was 41 individuals, but every year we're seeing more and more of that really young population. Again, it's a very specialized area, so we only have certain staff that are able to actually serve those individuals, hoping to get more trained, but that's a very specialized population. I also have employment status of those that we've served on here, just so you can see the different range of people that we're serving. 28% of all clients that we serve are employed, 21% are unemployed. We do have a really great program working with WCI. It's our IPS program where we help people find competitive employment in the community. We're one of the highest in the state for placement with that program. So it's a really successful program that we have to help people find employment in our communities. I also have on here the race and ethnicity of clients served. We know we have a very diverse community, especially here in Candioi County, and so our goal is always to help people have access to services. We know that our Somali community does not always tend to access services like we would hope, and so how do we reduce those barriers, increase access? So we keep track of this to see, are we having an impact? Are we seeing more people come in our doors from some of those diverse perspectives? You can see that Black or African American increased slightly, not a significant increase from year to year, but we're hoping to continue to monitor that over time and hopefully see that number grow. Any questions on any of those so far?
I have a question.
Yeah.
Do you have any stats on like, how many are in here for like, mental health and how many are like maybe for substance abuse? Do you have any kind of breakdown like that or?
I don't in here, but we certainly can break it down by service category. A lot of our clients are getting multiple services.
Okay.
So they might come in our door saying, I need therapy, and we're like, and you probably need substance use and psychiatry, and then we do those referrals. So a lot of our folks are getting more than one service from us.
Okay.
Or maybe in the community, so we can partner too with other community members. So if they're getting psychiatry somewhere and they get therapy from us, we can partner on that. But I can certainly get those numbers.
Do you
if
think
that'd be
most of
helpful.
it is mental health then or?
No, not necessarily.
Okay.
We get a lot, there's so much substance use coming through our door as well. We're seeing a big increase in that.
That's probably a
for sure.
mental health type of thing too, maybe, you know.
It's all in one book.
Yeah, yeah.
Right, so it's
Yep.
all kind of in one category. And what I would say is when somebody has a substance use disorder, the likelihood of them having a mental health condition alongside that is very, very high. I mean, it's a small percentage that doesn't have a mental health condition alongside their substance use condition. Somebody that has a mental health condition doesn't necessarily have a substance use condition. So it doesn't always work the other way, but when you have substance use, most likely you have some sort of mental health condition occurring alongside it. So it's really important to have that integration to treat both.
And if you have someone who has those co-occurring
Yeah.
diagnoses. They really need to clear up the substance use disorder aspect of it first before you get to the underlying,
Maybe.
maybe?
Sometimes we'll work with that person. Sometimes they're like, you know what? I'm not ready to stop using. Okay, well, let's talk about your depression. Let's talk about your anxiety and let's talk about how that's impacting your life.
Okay,
And then let's work you into, how your substance use is impacting your life. Sometimes they might say, I know I need substance use help, but I don't have depression. We're like, well, you might, but let's talk about that, right? And so we can kind of work with people on both sides. Our substance use program has mental health professionals integrated right into it. And so we can help monitor people and kind of help them along and do a really harm reduction model of how do we meet you where you are and move you to where you need to go, whether it's your mental health, your substance use, both. So really trying to help people wherever they're at. But yeah, sometimes it is treating one before the other. Hopefully, we're treating both at the same time. That's always our goal. But not everybody's ready. So,
well,
yeah.
thank you for clarifying
Yeah,
that for me.
yeah,
I
for
appreciate
sure.
it. Please continue.
Some other stats, most of our clients are living in private residences. 5% are in a treatment facility when we see them. So sometimes we're getting people as they're exiting out of a treatment facility. So that could be like a intensive residential treatment facility, a youth facility, and then they transition to us as they're coming out of that. The other stat to note is about 6.67%, less than 1% are listed as homeless. I think this is underreported. I really feel like we have more of a homeless population in our 7 counties that we serve than what is listed here. I think people don't always report themselves as homeless, even though they don't have a home of their own, they're living with a family member or a friend, they're couch hopping. They may not classify that as homeless, where a lot of us may. And so I think this is underreported data. The other piece to note here, commercial insurance was a primary payer of 18% of all services. Medicaid PMAP was 61%. And I want you to note this because typically our Medicaid PMAP percentage is at about 70%. That number is significantly down for us. And this has had a pretty huge financial impact at Woodland Centers. Because we're a CCBHC, our Medicaid rate is higher. And so when that percentage dips by 9%, it's hundreds of thousands of dollars of lost revenue. And a lot of people that are on commercial insurance also hit our sliding fee. So we're doing a lot more uncompensated care because of that percentage dropping. So just a note on that. Modality of service, did anybody have any questions? I know I paused for a minute just to see if there were.
Just like to follow up some more on this as
Yeah.
well as, we hear on the news all this talk about concerns about Medicaid and cuts and so forth. And the feeling that's happening already.
Yeah.
How that impact, it sounds like it'd be a huge impact, what you're saying.
It would be huge. It would be
And
huge.
also from the economic point of view for the county as well,
Yes.
because a lot of people are employed in this field.
Yeah, it would be pretty devastating to us. Medicaid is really our bread and butter. That is our population that we serve. If less people are qualifying for Medicaid, we're likely just to see less people coming in our door. They're not going to be able to afford the services. They're not going to be able to access the services. We're going to see our communities probably getting sicker and accessing care in other ways, likely the ER, law enforcement, which is not the route we want them to go. But if they don't have a way to access care any other way, they're going to go that route. So that's our worry, absolutely. Yeah. Modality of services, I also like to put this in here so you can see how our services being delivered at Woodland Centers. Of course, before COVID, very, very little was happening via telehealth, and that shift happened. But as time goes on, we're seeing more and more services move back to in-person care, which is that green bar. So in 2024, about 70% of all services were happening face-to-face at Woodland Centers, and only less than 0.5% were happening over the phone. We do have some outliers, which is below. So adult day treatment, outpatient, which is our therapy services, and then psychiatry. The majority of those services are happening over telehealth. So when we take those outliers out, about 91% of all services are happening face-to-face when you take those 3 programs out. And we have about 26 services and programs at Woodland Center. So those 3 are large programs, but it's not everything we do. So just to show kind of some of those outliers can skew that data pretty heavily for some of the other services that we're doing.
Yes, I'm sorry, Commissioner Imdag.
Thank you, Mr. Chair. So this question might be a combination of some of the things you've just talked about. So telehealth services doesn't, that would include Zoom, right?
Yes, it does, yes.
I was visiting with someone recently who was getting service via telehealth, and the person they were getting the service from is no longer, it was a contracted service. And this person got, the client that talked to me said, they're no longer employed or contracted anymore, so
Right.
they would have to find a different therapist. So is that a result of less demand or funds being cut or contracts being changed, like with us here at the county, or can you explain that a little bit?
Absolutely, yeah. So, middle of the year in 2024, this kind of goes back to that payer mix issue that we had. So in middle of 2024, we saw this reduction in Medicaid services. So we started to see less revenue coming in. We're doing more service than ever before, but less revenue coming in because people are either on commercial insurance or they're hitting 100% sliding fee. So we're doing more services, but less insurance is paying for it. So in February, we had to make the hard decision to say we have to reduce our staffing because we can't afford to continue to offer this level of staffing and not have any compensation for it, essentially. Where we went first was our contracts. We had contracts with a company called Innovatel. They do telehealth, psychiatry and therapy. They do excellent work. We loved our providers with them, but they're very costly. To have a contracted employee. And so we cut 5 of those employees to help reduce our costs. And then we had to do some of our internal staff. The internal staff that we did were indirect staff for the most part. So some care coordinators, some nurses. The direct care staff were those contracted employees. And it was really a financial piece due to the change in our payer mix. It wasn't anything related to contracts. The purchase of service contract really covers programs and services that helps us to support those services when we don't have payment, but it's just not enough when we have that payer mix change so drastically in a 6-month period.
Yes.
So is the result that some people will either, if they can find another provider and a way to pay for it, they go somewhere else, or they just stop getting the services? And so are people kind of falling through the cracks or just going without the service as a result?
So our hope was always that we would find those clients that are wanting to continue care and then get them to another provider. We did have a small wait list, but hopefully none of those folks fell through the cracks. It is possible. It's possible some people decided they didn't want to have care from us anymore. It's possible they decided to go somewhere else. It is possible some of them fell through the cracks because we had over 600 psychiatry clients we had to transfer pretty quickly, and I don't even know the number of therapy clients, but it was quite a few. It was quite a few. So that could have been some human error of just missing some folks. Absolutely, yeah. But the hope was always to transfer them to another provider.
Thank you.
Commissioner Burke.
Thank you, Mr. Chair. I just want to comment that, the Candido County Board of Commissioners is the mental health authority for the county, and East County operates that way. And we are expected to provide services as much as possible. And the services that Woodland Center provides is crucial when you talk close to 5,000 people contacts a year. And that's just 5,000 contacts. Each individual probably involves many contacts. And for the amount of staff and so forth, that it would be impossible for the county to provide these services directly. We do provide some services, case management, commitments, and so forth, and do a good job of that. And we got good staff doing that. But the scope of it is crucial, what you're doing. And it's really takes me back when we hear that because of financial issues, we can't provide the need out there. And it's always been that way to some degree, but right now, it's so important that we try to keep this going as much as possible. And I appreciate Woodland Center's part of that whole process. Makes me think going way back to Candido County used to be and still is a regional center for healthcare and mental health. And you go back to the state hospital, and that started back in the early 1900s, and then that changed, and people moved in the community. And mental health centers have been crucial in the process of that transition and now providing those services. So thank you.
Yes, yeah, it is definitely important to keep these services going, and I think the whole state is feeling the crunch. Every service provider is feeling the crunch, and how do we stay viable and sustainable and help meet the needs and the demands while not, honestly, I don't know how to say, bleeding to death, trying to serve everybody, that maybe the uncompensated care is becoming pretty unmanageable. So figuring out how to do that effectively is really important for us right now. So we're all strategizing and trying to figure out how to do it and partner, and I know everybody's feeling it, so it's not just us. Yeah.
Mr. Chair.
Yes.
Thank you, Mr. Chair. Also, from an economic point of view, going back to that statement again, what Woodland Center is providing for services is a big economic impact
Yeah.
for employees in our community, and
100%.
how the different dollars come here from the federal and the state that we fund these programs. Approximately how many staff do you have?
Now we have about 100 or 225 staff across our 7-county region. Yeah, and that's all levels. So we have people who are entry level, maybe peer support, have lived experience, all the way up to doctors and APRN nurses and everything in between. So we have a wide variety of staff that are delivering this care and services across our region. Yeah.
Thank you.
Yes.
So when you're looking at these financial cuts and other things like that, are you looking at the purchase of services with each contract? I know our Health and Human Services Director, and our fiscal supervisor within Health and Human Services, we review those contracts. I expect, all 7 county directors to review these contracts with case management and how we provide these services. Is there ways that, because I know what the amount we give to Woodland Centers is pretty hefty. And so we want to make sure that the dollars that we are giving are providing those services, because they're grants and taxpayer dollars. So are there ways that we can be creative, or have you had conversations with directors in that sense?
Not yet. We started to have some of those conversations. So Woodland Centers meets with the 7 county social service directors every other month, and we have those conversations to figure out what are we doing, what's on the landscape for the counties, what's on the landscape for Woodland Centers, how can we talk about the contracts and where we're headed. Yeah, I know there's some bleak things ahead as far as the state budget and the governor's potential budget and what that looks like for counties. And so we started to have that conversation too of what are the resources and what is that going to look like for our future? Nothing specific yet, but I think that is the brainstorming and that partnership we all need to have together of how do we do this together, because we're in it together. And so how do we make sure we are stronger together and support each other and just help build those bridges as much as we can. Absolutely. And be fiscally responsible. That's a huge part of what we want to be. We don't want to be that partner that feels like it's fiscally irresponsible. So how do we remain fiscally responsible and viable for our community? It's a big part of what we want to do.
We'll go ahead and we'll let you finish the
All right.
rest of this, and then
Yes.
we'll, if there's any comments
Sure.
or questions, we'll handle one or
Yes.
two.
So the next couple pages talk about urgent care. So Woodland Centers has done mobile crisis services for many years. In 2023, I believe it was, we started urgent care. We saw this as a need in our communities. And so mobile crisis is a service where we go to you, we come to your homes, we provide services. Urgent care we saw as a need because not everybody wants us to come to their homes. And when we said, come to crisis, they're like, don't want to stay, thanks. So they wouldn't come to us either. So we said, okay, we'll come to urgent care. This is a model where you come in, you see somebody, you go home. And this is really taken off in our communities. So as you can see, the services continue to grow every year. Last year, we did 704 services in our urgent care. We just see more people coming through this door. And so it's been a really great service here in Candy, Ojai. It's open 8 to 4, Monday through Friday. We have law enforcement coming in, touring the site, dropping people off there, saying, hey, this person just needs to talk to somebody. So I think the more we get the word out, the more people use this service, the more it's going to grow. So it's been a really great service for us. And then mobile crisis is tied along with that, but I just have that data in here too, so you can see mobile crisis continues to, again, grow and just be a really valuable service in our community. Assessments, just for your knowledge base, assessments are when we go out initially, meet with the person, kind of determine what's going on, determine any future services they might need, and make some recommendations. Stabilization is that service we do in between. So they might have the assessment, they're referred for services. It might take a week or two to get them into those services, so we can provide some stabilization in between to just help keep them moving on a good path. and keep that connection. All right, so that's mobile. And then I just put in some staff data. Again, this is a little bit updated based off of some recent events, but we were at about 250 staff. We're down to about 225-ish at this point. Most of our staff are full-time that we work with. And I did put in the retention rates. Woodland Centers, we've worked really hard on improving our culture, improving our community for our staff. And so our retention rates went from 77% to 95% in 2024. Turnover rates from 23 to 16%. So when people come work for us, they stay and they enjoy their job with us. It's hard work, but we work really hard to support our staff and keep them in this field because we know there's a lot of turnover in this field. Some key accomplishments, we are still working on our youth and adult crisis remodel. The remodel is actually finished, we're waiting on licensing. So when we get that finished, we will have a few more beds for adult and another bed for youth, and we are seeing wait lists. So we know there's a need in our communities. We are just waiting on licensing to give us the blessing to open those beds. And that's been a long process, unfortunately. We did roll out measurement-based care. This is a platform that we're using to automate assessments for our clients and then use that information in a meaningful way in session with every provider at the agency to say, how are you doing? And let's use this information in our meeting today to figure out what our goals should be today while we're working together. So for example, if somebody says, hey, I'm not sleeping very well let's work on that. Like, what can we do to help you sleep better if that's a problem that you're facing? Because sleep impacts everything we do. And so as providers, we can work on that with that individual when maybe they wouldn't have reported that without this assessment tool. So it's something that we're using in all of our sessions. We also rolled out AI technology last year with Elios. This sits in the background of our sessions and helps our clinicians and our staff with their documentation. Nobody went into this work to write notes, but we have to write notes. And so this really automates a lot of that process and has our staff then review that and edit that so that we can write really nice notes, but also captures the information. Our notes went from 15 minutes per session down to 3. So we are saving a lot of time and energy from our staff, but still writing high-quality notes. We are doing substance use assessments in like 7 or 8 jails at this point. This is really vital for us because we can then see those individuals while they're still incarcerated and give them recommendations and help with treatment coordination to actually get them into the care they need as they're discharging out of jail services and into treatment services. So most of the time, our hope is to not have a time where they're in the community, that they actually transition from jail to the treatment because that helps with the relapse rate for these individuals. What else? We started a pilot project with the Kaneohe County Dispatch. We have our mobile team in there 8 hours a week. We started this in December, so it's still pretty new. The hope for this was that we could take some calls off of dispatch's hands. So when somebody calls 911, our hope was that our mobile team being in there with dispatch, they could say, this sounds like more like a mobile call than a 911 call, than a police dispatch. Or we could dispatch with law enforcement and hopefully intercede quicker with our mobile team because we know a lot of those calls coming into 911 don't necessarily need law enforcement intervention, but it's the number people call because it's the number they know. And so again, this is pretty new. We meet with law enforcement and dispatch pretty regularly to say, how's this going? What are the problems? What are we running into? We had applied for a grant to hopefully expand this. We did not get that grant. So we're working on what are some other ways that we can work with this model, look at this model. So just a starting point for us at this point. And then of course, Kids Connection here in Willmar. It's still going. We have one today. If you ever want to check it out, it's a wonderful, wonderful event we have here in Willmar. Again, one of those community partnerships that we do to help give a great experience for our families in our community, some outreach efforts. So if you have any questions about it, happy to answer that. But I think you all are pretty familiar with Kids Connection, so.
And that is at Uptown Wilmer again?
It is, yes, it's at the
And
mall.
starts at 4?
Starts at 4, yes, 4
Okay.
o'clock, I think. 3:30, 4, yes, I think it's 4. The time has changed a few times. So this year, I mean, our focus really is on stabilization with everything happening federally and statewide. We are just buckling down the hatches and trying to see how we can weather the storm as best as possible because we know a storm is brewing. We just don't know exactly what it's going to bring. So just really monitoring everything that's happening and figuring out how we can work our way through it and partner as much as possible to work our way through it. So that's what I have for you all today. What other questions thoughts do you guys
Any,
have?
Commissioner and Dick?
Could you go back to what was just on the screen?
Yes, please.
So I'm looking at the retention rates. That's a
Yeah.
remarkable change.
Yeah.
From 2023 at 77% up to 95%.
Yeah.
Can you share some of the steps you took to affect that change?
Yeah, absolutely. Our leadership team really focused on this. We know there's high turnover in the mental health industry, in the substance use industry. People were leaving the industry. We were short-staffed all the time. I mean, we still have open positions, but part of this was us working on how we communicate with our staff. We rolled out a Nectar, which is a employees a system for employees to recognize each other, a recognition platform. Because what we were finding was people would recognize people within their program, or maybe just their director would, but there's a lot happening between units and programs. So I think that was a big piece of it, of just having more recognition. As we became a CCBHC, I think a big part of this too was helping our staff work together as a team. We still have some silos, but we were very siloed. If you had therapy, you talked to your therapist, and then you had psychiatry, and that was your silo, and you had arms, and that was your silo. Now we have team meetings, so every Tuesday and Thursday morning from 8 to 9, those teams that meet with that individual, so if somebody was seeing Corky, his team would meet and say, how's Corky doing? What's been happening with him? What are some updates that are going on? And every provider from that team comes together, and it could be a 10-minute meeting, but they're all getting to know each other, and they're getting to know the different services that are happening, and people have really appreciated that. Another thing we did was a peer support group. So it's everybody that's a mental health practitioner, you can come once a month, and it is your team. There's no supervisors, no directors, just come and talk about what's going on, because this work is really, really hard. It's really stressful. There are really bad days. We lose people. And so come to this meeting and de-stress, talk to your peers. And we have people that lead these meetings, and it's really an opportunity for people to come and just have a space. So I think that's helped as well. Trying to think of what else we implemented. We partnered with Illuma Mental Health Center, who's up in Crookston area, and we have an EAP with them. So our staff can get up to 8 sessions for free, not going through insurance, and their family members can as well. So just building in a lot of self-care, building in a lot of recognition, listening to them, trying to get more input from staff. That's been a lot of it. Mhm.
Any last questions or thoughts for Dr. Chose? The one thing that I just did want to say is that under your commitments, I think the one that struck me the most was normalizing mental health and wellness.
Yeah.
And we can shout this to the rooftops, but there's no shame in asking for help.
Never.
This is a completely stressful world right now. And I was fortunate to be able to receive services as a much younger man. And that helped me get to where I needed to be able to be productive and be clear-headed about things. So I'm always going to be appreciative to Woodland Centers for the help that they gave me, and anyone out there who needs help, assistance, even if it's tough, just ask.
Yeah.
You know,
That first call.
there's no harm in asking, and what if the miracle happens?
Right.
And you get the help that you need. What's your life look like then? So.
I appreciate you sharing your story. I think it's valuable when others can see other people reaching out and getting support and help. That first call is the hardest call. We know from statistics, people wait 8 to 10 years from their first symptom to when they actually reach out for a treatment. And we want to have an impact on that number. I want that to be not feeling well. It's been 2 weeks. I need to make a call. That would be my goal. Like, let's get it down to a month. Let's get it down to 3 months from 8 years. That would be fantastic. So thank you for
Outstanding.
that. Yeah.
Well, thank you so very much for your report today, and best of luck in navigating the choppy waters that are ahead of us all.
Yeah, thank you all
Yes,
for your
all of us.
support. I appreciate it.
Thank you so much. Next up, we have Child Abuse Prevention Month. There is a proclamation and a Children's Services update, and Director Khan, would you lead us off here, please?
Yes, good morning, Commissioners. My name is Caroline Kahn. I have the privilege of serving as the Health and Human Services Director for Candy, Ojai County. This morning, I am just going to do a brief proclamation read and request that you guys join or uphold this proclamation for Candy, Ojai County for the month of April, and then I will turn it over to our supervisors, who will give you an update on our Children's Services Department here in Candy, Ojai County. So if you all want to read along with me, you certainly can. Mr. Chair said that I get to read it this morning, so. So, a proclamation for Candy, Ojai County, Candy, Ojai County Child Abuse Prevention Month for April of 2025. Whereas it is critical that children are guaranteed their health, well-being, and protection. And whereas thousands of children in Minnesota are affected by child abuse and neglect each year, often causing lasting psychological, emotional, and physical effects. And whereas all families can benefit from strong support systems and resources in the face of challenges. And whereas, although intervening in the lives of children and their families is an important responsibility at all levels of government, preventing abuse and neglect is a shared obligation. And whereas effective child abuse prevention activities succeed because of the partnerships created between child welfare professionals, education, health, businesses, community organizations, law enforcement agencies, faith-based organizations, and families. And whereas Minnesota's enduring commitment to prevent child abuse and neglect demands that individuals and communities partner together to support parents in raising their children in a safe, nurturing society. Now, therefore, the Candy, Ojai County Board of Commissioners do hereby proclaim, this is where maybe you should have read it, April as Candy, Ojai County Child Abuse Prevention Month, and urge all citizens to join in to promote the safety and well-being of all children and families, and to recognize the child welfare professionals and allies who work tirelessly to protect our children. Let us also honor the strength and resilience of survivors of child abuse. So today I would ask that as the Board of Candy, Ojai County, that you guys would lift up Child Abuse Prevention Month in Candy, Ojai County.
You've heard the request of the director. Would anybody like to make a motion?
Mr. Chair? Mr. Chair, I so move to, that the Candy, Ojai County Board of Commissioners approve the proclamation for recognizing Child Abuse Prevention Month.
And I'll second that, Mr. Chair.
Thank you very much. There's a motion and a second. Any discussion?
Mr. Chair? Thank you, Mr. Chair. I think this would be a good time to also mention about child protection work and our staff. And I think we all know what a challenge that is. It's probably one of the most challenging job as a social worker that our staff have to do. And just to say thanks to them as well, and that's what we're doing as a board, but that is just fantastic what they're doing out there. And I don't think the public has a clue when you go see somebody and what takes place. And unfortunately, too, how child protection has changed over the years. And you end up having to do all this paperwork and everything else and dotting all your I's and crossing your T's without and yet being out there with the people that are really hurting and helping people out. And as we were talking about Woodland Centers, you know, their job is to save lives, and so are we. Thank
Well,
you.
you teed me right up, so can I go into my introduction?
Please
and they can tell
do,
you more
yes.
about that?
We'll do
Yeah.
that we'll do that just as soon as we vote.
Oh, sorry.
So that's all right. Anybody else? Anything else? All in favor of proclaiming April as Child Abuse Prevention Month in Candy, Ojai County, signify by saying aye.
Aye.
All opposed? Motion passes. Thank you very much. Please continue.
All right. So as
Sorry,
Commissioner Berg indicated, the world of child protection and child welfare is very complex and tolling. And it's also very rewarding because you get to make a meaningful impact in the lives of families within Candy, Ojai County. So it is my privilege today to introduce our supervisors. One is not able to be with us today. Carly Kranz is one of our children's ongoing supervisors. So in lieu of her not being able to introduce herself, I wanted to be sure to lift her up and recognize the work she does in leading her team. And I'll let the rest of them introduce themselves.
Come right up and pull the microphone towards you if you need to.
I'm Stacy Garis. I joined Candy, Ojai County this past June. I supervise the intake unit and then child protection assessments and investigations. My team is comprised of 12 workers. 8 of those are social workers. and then 3 case aides that do the support work, and then the intake worker. She does do intake for the entire agency. As far as child welfare reports go, we screened well over 1,000 reports last year. That's typically done twice a day in my unit. We have standing appointments at 9 and 3. That tells you how busy it is. When we screen reports, we base it on the statute. We obviously, while we can make a difference in families' lives, we don't like to get involved if we don't have to, because we do realize the trauma that can cause also. So when we screen reports, we have 2 tracks we can take. Well, I guess we can screen it out, but if we screen it in, it could be a family assessment response, or it could be a traditional investigation. Those investigations do have maltreatment determinations that are made, which is pretty significant, so a lot of thought goes into those. Last year, we had completed 169 family assessment responses and 251 traditional investigations. We also, for those reports that get screened out, we do have the option also of, if there's concerns but not enough that we need to screen it in, we can still offer the family's child welfare response. That is completely voluntary service, and just, hey, like, we notice you have some concerns, would you like some help? And they can choose to accept that help or choose not to accept that help at this time. And then we also have PSOP, so it's a parent support program. We partner with UCAP for that. That is also voluntary, just to give family, just to give them a little support with whatever they might be needing. Along with that child welfare response, that, like I said, that's if there's concerns but not enough for us to screen it in. But that is also where we might assist law enforcement with some forensic interviews in cases of sexual abuse. We are the first contact with families, so we have 45 days to complete our assessment or our investigation. And then at the end of that, in the investigations, we would decide if there's any maltreatment determinations, any additional services that would be needed beyond our involvement. And if additional services are needed, then that would go to Carly, who Caroline had already introduced, and then Nicole. They supervise the ongoing child protection units. It's kind of a brief overview. Any questions regarding that piece?
Not at this time. Thank you so
Okay.
much, and thank you for the work that you do.
Hello, my name is Nicole Munson. I have been with Candy Ojai County just about 4 years next month. I've been a supervisor since September. I am one of the 2 ongoing child protection supervisors. Our 2 ongoing child protection units are made up of a total of 13 social workers and 3 case aides. At the end of 2024, we ended the year with 106 open child protection ongoing cases and 65 open child welfare cases, for a total of 171. At the end of 2024, there were 69 children in out-of-home placement. The most common reason for children entering out-of-home care in 2024 was due to parental substance use with a percentage of 33%. The second most common was tied with both physical abuse and alleged neglect with percentages of 12%. And then the third most common reason was psychological or emotional abuse. And then that was also tied with child mental health issues with percentages of 9%. In 2024, we had 9 adoptions that were finalized and 8 children who had permanent legal and physical custody transferred to a relative. We did serve 30 families, including 50 children that participated in the Parent Support Outreach Program, which is a preventative case management service we contract with United Community Action Partnership to provide. And currently, as of the end of February 2025, we have 58 children on a home placement, with the highest percentage of the children being in relative homes with 44.8%. Any questions?
Are there any questions for Nicole? All right, thank you so much.
Good morning. I'm Robin Stryker, and I Recently came to Candy Ohio County, going on 8 months now. So I supervise the child foster care licensing truancy program, which is part of the child welfare, and then also children's mental health. So in total, I have 11 staff, 5 which are children's mental health workers. I have 1 child foster care licensor. I have 1 family child care licensor. And then I have 3 truancy workers and 1 case aide. So like Nicole said, most of the kids placed in foster care is in relative care. That is the biggest push from the state, is to always look at relatives first. You know, it's important to keep families together. If they have to be placed in out-of-home placement, it's important to keep them with relatives. And so there was, in 2024, there's a total of 62 open child foster care home licenses. 47 of those was relative and 15 was traditional. So that's pretty good, you know, that the majority was the relative. So far in 2025, we have 35 open foster homes, and 28 of those are relative and 7 traditional. And so we also have Candy Ohio County kids placed in 9 homes outside of the county that we don't license, but that county licensor would license those homes. For truancy, like I said, that was part of child welfare as well. And so we have, it's a little harder to gauge the truancy since it's based on school years and they have that summer break. And so far in the 23-24 school years, we sent out a total of 217 referrals for our TIM program. And our TIM program is the truancy intervention meeting that we partner up with the county attorney's office and the schools to, to invite families who are on the cusp of being filed for truancy, a habitual truant. This meeting takes place twice a month on a Monday evening. The families are invited. It's not mandatory. It's highly recommended that they attend. The county attorney's office does provide a PowerPoint presentation. Usually there's a representative from the school there to meet with their student, and then we have one of our truancy workers there to also meet with the family. Talk about what are the barriers for kids not attending school. What are things that we can do to help? Once they attend this meeting, then our workers try to do a little bit more preventative work up front before, with the hopes of it not getting into court. So our workers will reach out to the school, monitor their attendance after this TIM meeting, contact the family if there's struggles. If they're doing well, you know, just contact the family saying, way to go, way to get your kid to school, or what can we do to help you? What, you know, is there in-home services we can put in home beforehand? Do you need help getting the kid, you know, to school? Our workers have gone to the home at 7 o'clock in the morning to help get them up out of bed and offer them a ride to school. So we're trying, you know, to be creative on what can we do to help get our kids to school so that they get the proper education that they need. So like I said, in 23 to 24 school year, we had a total of 217 referrals to our TIM meeting. So far this school year, we have about 148 referrals. Now, we do see an uptick in the referrals coming in the last couple months of school, but I would say we're probably close to being on track with the same amount as the year before. But 23 of those cases currently are in court. So out of 148 referrals, 23 cases are in court, which I think is pretty darn good for our preventative work that we're really trying to do and you know, to keep these families out of court.
Could I ask a question?
Commissioner Anderson.
How many of those people that end up where you talk to them don't realize that their kids are supposed, when they don't show up to school, that you should call it in or whatever. Because I never knew that with my kids until
Sure.
I became a county commissioner. It was like, oh, okay, I could have gotten in trouble. We just didn't take it serious. And the school is always
Yeah.
telling us, you gotta call it in, and we're just, well, yeah, well, he wasn't feeling good or we decided to go somewhere.
Yeah. So the schools have to do some work up front. They send a letter, they should be sending a letter or reaching out to the families when there's 3 absences, unexcused. They do have, like in their policy, they can have so many excused absences, but then once they hit that number, I'm assuming they're contacting the family and say, hey, you've excused this many times already. What's going on? Or now they're going to be unexcused. But the schools do reach out to the families up front. They will have a meeting with the family or request a meeting. And there are times when they will request one of our workers to attend that meeting with them before they even get a letter sent to them to attend this TIM meeting. So,
Thank you.
yeah.
Any other questions, Commissioner Berg?
I just want to let you know that I really appreciate hearing the numbers, and I think it's so important that this presentation that you just gave is really good for the taxpayers to know where their dollars are going, that we provide important services here. And this is an area they don't hear much about. And thank you.
Yeah, absolutely.
And I just wanted to piggyback on something you said earlier. Is transportation a really big hurdle for a lot of these families? Or what do you primarily see?
It is a barrier. Transportation is a barrier. And, there are some kids that just won't walk to school, Their siblings might, but with busing not available within that 2-mile range, that can be, that is a barrier. And then, we have some 6 or 7-year-olds that are expected to walk to school, because they're within that 2-mile range. We do have a couple cases where our worker, especially on those really cold days, had gone out just to give rides to these kids and their siblings because maybe the parent, couldn't, or, their car is broken down, or, for some reason. But, overall, I would say transportation is a barrier.
Or they do shift work and they're at work.
Yep, correct.
Sure. All right. Well, thank you
Yeah,
for this. Are
absolutely.
there any final questions for the group here? Well, thank you for what you do. And Caroline, go
Yeah, I
ahead.
just wanted to make a final comment and just, again, lift up the work that this team is doing. I want to recognize, and I apologize because I should have checked this number before, but I believe my first report that I gave to you all related to our children's services indicated a drop from about 120 out-of-home placements down to about 80. And I want you to recognize the work that this team has put in has brought that down even further. Today 58. That's remarkable for Candy, Ojai County. That is in comparison to our smaller county neighbors and the work that this team is doing. There was a season at Candy, Ojai County, went through years of turnover within our children's team specifically. And if I'm recalling correctly, since July of last year, and why I'm marked July, I'm not sure, we've had about 2 transitions. And that's remarkable as you look at the work that this team does. As mental health and substance use work, as Dr. Chose said earlier, has high turnover. This work is not easy either and does typically. So I want to continue to lift that up. I also want to lift up our partners at the county attorney's office and our law enforcement friends, because the work that we do is successful because of the partnerships that we have with them as well. So with the Child Abuse Prevention Month is, primarily held within our responsibility, but is not siloed work. So I want to lift them up as well in this excitement.
Well,
No, not excitement,
as
but-
do we, Commissioner Anderson.
When you say 58 out-of-home placement, does that mean that's how many are in foster care? Is that the same as foster care, or is that different?
Yes, it's out-of-home place. They might not be in a foster care setting, but they are not in their home.
Okay. And then, maybe this isn't germane, but how many are in foster care?
Well, all of
Is that
those would
the
be,
same?
some may be in like a mental health placement, some may be in a group home. So, it is all out-of-home placement. It's just a matter of what the placement type is.
Okay.
And if I can interject too, this was one of the things that I have been, I've asked Caroline and her team to provide a report to the county board because out-of-home placements is so important because it's mostly levy dollars. And so when we see those numbers at, that capacity, it's the whole judicial system. It's within the county attorneys, law enforcement, human services. And so to see this number decrease is kudos to this team. Kudos to this team. I mean, this is phenomenal numbers to see in the county our size and the positive work that you all are doing and the care that you have for the residents, for your clients. This is something to be really proud of. I mean, when I saw that number, I did a double take because that's very unheard of. And so, I don't want the commissioners or board to think, oh, are we not doing our work, right? Because we're doing it a different way, and we're doing it more of a proactive way. Sometimes human services gets a bad rap because we're so we aren't proactive. And so I want to just really applaud this team because we haven't seen these numbers in a long time within this county, and it's just a lot of work, and it's not easy work, and I could never do it. I always say that, but just good job, really good job on that.
Absolutely, and we know that out-of-home placements have been a huge cost driver on the levy for some time now. So the work that you're doing, I think the taxpayers would thank you as well.
It's also the right work to be doing. So it's a win. So
Well, thank you so much for this presentation, and Caroline, you have one more item for
I
us.
certainly do, and we're going to kind of continue
Take a
the,
break, please?
Yes.
Okay.
We'll take a quick 5. Thank you so much.
It's a big deal. Well, and out of
Candidacy County Board of Commissioners is back from recess. Caroline Kahn, our HHS Director, is still at the podium, and please take it away.
Yeah, so I'd like to continue our conversation about families that we were just having prior to the break, because we have a unique opportunity in Candy, Ojai County to really kind of continue to lean into this work and start involving some of our community partners with the opportunity to accept a Family Resource Center Explore and Assessment Grant from the Sauer Family Foundation. Last week, we were told that we were awarded the funds that will be pivotal in helping us do some strategic work to see how a Family Resource Center might impact our county specifically. It's a refreshing timeline because all of our neighbors are going through the similar process at the same time. So you'll see some areas in which that will lean into each other because, like we saw earlier this morning, Woodland Centers is a prime example. It's a partner within our communities that's engaged in all of our communities. So it's very timely to be doing this work together. So if we move on to our core vision and outcome, we'd like to conduct a thorough assessment of our community needs and identify future opportunities for a Family Resource Center. Following the completion of this grant, our hope is to find a clear recommendation for our county's next steps and ensure sustainability of whatever that might look like. Our guiding values will be community-led decision-making. We were told that we have a very bold goal, but Candy, Ojai County does bold. We'd like to get 10,000 voices throughout this initiative, and we feel like 25% of our community is a minimum of what we should have in guiding this work. We'd like to see multi-sector collaboration, do culturally relevant services, and find sustainable funding strategies to move this work forward. To do this, we developed a design that was really kind of gleamed off of other counties' work, specifically Olmsted County had a great platform for what they called the co-design, or also could be looked at as community design process for engagement. This would be partnering with Creating Communities Consulting, which is also the same consultant that we'll be using for our Community Health Board, Community Health Improvement Planning tomorrow in the NPR, as well as the same consultant that will be working with all of our neighboring counties as well through their FRC assessment. We'll be looking to host monthly meetings at approximately 2 hours per month. And then between those 2-hour meetings, asking our co-designers to engage in about 8 hours of work within their network. So within the co-design is they'll come, well, I'll get to that later. Our key stakeholders will be our department within Health and Human Services, yourselves as commissioners. We're hoping to gain this support and stakeholdership in our schools and our youth organizations, our community foundations and healthcare organizations, our faith groups and business leaders, as well as residents with lived experience in Candy, Ojai County. So as I mentioned, with our partnership with Creating Communities Consulting, they'll support our leadership guidance for this co-design or community design process by facilitating our momentum meetings, which is what we'll call our 2-hour meetings. During that meeting, we'll have conversation about what is our task and our objective over the next month. After we launch, we'll have a conversation about what have we learned from our tasks, such as reaching out to our networks. My network is not the same as Commissioner Gardner's network, which is not the same as Commissioner Dale Anderson's network, and so forth. So in doing this kind of spoke and hub model, we're hoping to reach more voices and community members to engage their feedback. By working with a consultant partnership, that work will be moved forward in a strategic fashion that will lend again in that same model regionally. We're hoping this will result in inclusive participation for our strategic recommendations. And then they'll also provide the training on family strengthening and support standards that is set forth by the Family Resource Center National Model. Also want to highlight that this was one of the identified partners that the Sauer Family Foundation agrees for recipients to engage with. So we vetted some of the various partners as a region to come down to this recommendation. Our data collection will focus on quantitative data such as the demographics and population trends, economic mobility and employment, health, education, childcare, housing, and food security. Our hope is to take all of this floating data information throughout our county and bring it into a succinct summarized report. What we collect here through public health is different than what CentraCare collects and different from what Woodland Centers and UCAP and all of our partners. So we'd like to engage in this profile building in a succinct fashion to benefit our county. We'd also like to do some qualitative data gathering in informational surveys and asking our staff to participate in some micro conversations within the work that they're already engaging with. At a ballpark estimate, my department engages with about 15,000 members of our community on an annual basis in different fashions, and we hope that we, even just doing that, will help leverage get us to those 10,000 voices. We'd also like to share in success stories and cultural considerations. Like I mentioned, our bold goal of gathering 10,000 voices will be done through our co-design team of local residents, cultural organizations, school and healthcare providers, businesses, nonprofits, faith leaders, and government agencies. And again, monthly meetings, surveys, focus groups, and outreach initiatives throughout that process. Kind of bringing that further, we'll use some survey distribution through staff, online and paper surveys, social media, and local media collaborations through QR codes, radio ads, and local newspaper inserts, and do a targeted approach with some of our large employers and see if we can get them to help share our data survey to collect that information. Our goal is to not just build something that benefits one segment of our population, but our community as a whole, regardless of demographic. Our focus groups will focus on small discussions with our co-designers within their networks. And then community conversations at a larger scale, similar to what some of our partners at PACT recently did with in bringing in community members, or what we're doing through public health in some of those community conversations. We have a rapid timeline, and this timeline is important because it will help guide and engage our decision-making and our thought process as we also move forward into the legislative changes that are coming in 2027 and how we work with families. This is a very timely project because it'll help us provide an opportunity for us to leverage further information and data to help us do greater work in various fashions within our scope of children's work, but within our department as a whole. Our 9-month timeline will launch in May and go through February with our community assessment and stakeholder engagement, then moving into our data collection and analysis of our needs, develop a family resource model for recommendations, and then finalize and implement a plan for next steps. This means that implementation plan will be, we bring this forward throughout these targeted phases to engage your involvement and community's involvement through these meetings, and just kind of bring forward recommendations for this board to consider of what this model could look like or not. We could gather information and decide this isn't a model that would benefit Candy-Ojai County, but it's important information for us to have to make a decision such as that. The next timeline just kind of gets a little deeper into activities of the timeline and launching and our momentum meetings, our targeted focus groups, and then validating findings. Our expected impact is to grow stronger families, impact our economic growth within our communities, and provide community resilience through a sustainable and adaptable model for long-term support. May of 2024, we did a tour where we went and checked out Scott County and a model that was different in Stearns County. So we've been talking about this work as to how it could potentially impact Candy-Ojai County and kind of kicking around the can, but now we've developed a strategy to move this work forward. Our next steps would be to finalize our co-design team, conduct a broad and targeted community engagement, synthesize our findings for our roadmap, and ensure a community-driven sustainable model for a family resource center in Candy-Ojai County. So I wanted to provide a space to start this conversation, bring everybody on board for the work that we hope to do strategically within the Health and Human Services Department to better understand our family's needs and our community needs. Family doesn't necessarily mean you have a unit. Family can mean friends, it can mean whatever, it's not the same. So for our community, we're not necessarily looking at it as just a parent-child relationship. It could be a sibling relationship, it could be a parent-child, but in the elder demographic, we really need community resource centers and community work and how we're going to move things forward as well. So I'd like to leave space for questions. I believe financial implications is in kind from our county, as well as we did receive about $96,000 from Sauer Family Foundation to engage in this work. And the additional costs will be done, supported through that grant.
Caroline, just a quick question. What do you see the role here of our elected board here in working on this? Is this something that you want us to have some involvement in, or
Yes,
are we just gonna
absolutely.
receive this at the end?
No, I would like to have your involvement, providing your input on key stakeholders. I can send out a recommended list and work with Administrator Baker on that as to who we are going to target for our co-design leader team, about 10 to 12 individuals. I'd like to bring this forward as conversations. We can move it to a larger work session as we move further into like gathering data and our recommendations, so you guys have some time to kind of feel through things. But I'll lean on our Health and Human Services Committee members for that monthly approach of saying, this is where we're at. Are you wanting us to bring this forward every month? Are you wanting us to bring this forward every other month? But really talking about that conversation and being a supporter and a champion, helping spread the word. If we're sending out QR codes and surveys, making sure that you have recommendations within your districts that we should be putting that information at. Because really, we want the voices of your constituents within your districts to be heard through this process.
Outstanding. Thank you for that. Commissioner Dwayne Anderson.
Yeah, so tomorrow you have a meeting down in the multipurpose room. What is that called and what time is it?
The Community Health Improvement Plan through Public Health. So every 5 years, we go through our community health assessment, and then we work through our Community Health Improvement Plan. So these are, again, kind of timely pieces that we can take this information and infuse it into other projects as well. But that project is where we'll be talking our community health assessment, leveraged substance use, mental well-being, and the aging population really rose to the top. So tomorrow, during our community health improvement plan process with the community, we'll talk about how do we want to address those issues and who is going to come alongside public health to do that, and how can public health come alongside other organizations to help carry that work. This work is not intended, that work specifically is not intended to be done just by public health. It's intended to be done by public health helping convene community partners to address succinct issues within the community. So
Yeah, and that was the flyer you had me hand out to different areas in my
it's
district.
prime
and
example of how I would
think
like.
Commissioner Berg got some of them too. But what time was that tomorrow?
It starts at 1 o'clock
1
to
o'clock.
4.
Okay.
The registration is encouraged, not necessary, but we'll be working through what we call results-based accountability and how can we take and make that accountable action in that project and moving it forward. So some of the information we will be learning through our community health improvement plan process and our community health assessment is data and resources that could be, again, leveraged through this Family Resource Center, information gathering and data analysis. So thank you for the opportunity to highlight that again, because that will be important work, and I'd like to see a very full room tomorrow.
Any other further questions for the Director, Commissioner Emdek?
Thank you very much. You mentioned, and I think these family resource centers have some great potential. However, I do have some concerns about budgetary things. So how many, how much staff time do you anticipate? And where's this staff going to come from to, this is a very aggressive 9-month project here. To touch 10,000 people is extremely aggressive, I think. And explain where the staff is involved here.
Yep, thank you for that. I agree, it is very bold. And if we don't hit it, even if we're halfway there, it's still a success. So the staff time would be at your regular meeting, taking 5 minutes out of that conversation at the end to say, could we fill out this survey together? So incorporating it into the work that we're already doing, or handing it out as we leave to say, hey, if you wouldn't mind leaving your voice, having your voice be heard through this work, we'd like you to fill out this QR code or this survey. So it's not taking out additional time. The staff time that will help lead the project is built within the grant in identifying a public health coordinator to help lead this work. And then the grant is helping cost or offset those wages for the work that they will be doing on approximate probably 8 hours of actual staff time per month for them to lead that work, sit in those 2-hour meetings and help lead that with our co-designers. Our co-designers are voluntary for the most part, may look at providing some paid interpretation we built into the grant as well to make sure that our non-English speaking neighbors are heard. So really not an intensive, so maybe about an hour and a half max of 5-minute increments throughout your monthly work. So, and putting a number for an in-kind portion, that was the average that we came up with of if you do every meeting, you just have that brief conversation.
So this grant from the Sauer family at 96,000, I think I heard you say?
Yeah, I apologize. I thought it was in the presentation and I don't, about 90.
It is.
Yeah,
That's for the planning process.
for the 9-month process of staff time, the consultant work, any media coverage, facilitation of surveys, distribution, all of those tangible costs will be covered by that grant. So
And then I don't know if you saw the article in the Minnesota Star Tribune yesterday about family resource centers.
I didn't have an opportunity to, I heard that there was coverage, but I haven't had an opportunity to read the Star Tribune yet.
Yeah, in yesterday's paper, there was a very nice article about the success. There's about 9 of them across the state, and they highlighted Scott County.
Yep.
And I know this is grant dollars, not levy dollars, but staff time is levy dollars. Would we not be able to just maybe look at one of those 9 already developed plans and say, here's one that works, might work best for Kaneohe County? And the other part of it, and I'd like you to speak to this a little bit, is they talked about the success of of course, they're not there very long, they haven't been in existence very long, but the perceived success of the family resource centers, they covered far more than the youth. They covered like somebody who needed resources. Over the weekend, I had somebody ask me about a family member who's living in a house that's being warmed by a space heater because they can't afford the rent on the building. They had to let their apartment go. And so that would include people like that. So once you get to implementation, in the article, it talked about how there is nothing in the governor's budget or legislative budget beyond 2027, which is just 2 years away, to cover any of these costs.
That's fair. I'm going to try to answer your question as to how I remember them. So I'm going to start with learning from our neighbors. And that's something that we've already started and will continue to do. We call those a community of practice. What's very evident after we visited Scott County and visited Stearns County is what works in one community might not work in Kandiyohi County. Scott County has found significant resources saved through their out-of-home placement costs and through some other areas in which they've worked, which their directors have said they've pivoted now from instead of spending it here in out-of-home placement or for lack of a better term, reactionary work, it's moving to more preventative work. And that's how, so it's not additional levy that they're seeing spent, but they're seeing more strategic levy spend in how they're impacting their communities, to speak to Scott County specifically. What might work in, I think, St. Louis County is another one that has, that they rotate between 2 areas because it's a large transportation. So they work with their library in one community and a community center in another. And they're at different times of the month, they're in different areas. Could be a model that might work for Kandiyohi County. Some other areas explore mobile bus transportation where they have a family resource center bus moving around. The important part about this opportunity is it helps us no requirement that at the end of this 9-month period, we say, yes, we're doing this. To speak to the governor's budget, yes, there is nothing in legislation at this time for anything new, but there is money within the Sauer Family Foundation for implementation grant. So if we didn't get in here at this time or at the May timeline for this explore and assess portion, we would not have the opportunity to apply again for Sauer Family Foundation's implementation grant. So what this does is leverage us and have the opportunity to later apply again to the Sauer Family Foundation for additional implementation funds as they sunset their family foundation. I think it's really inspiring that the Sauer family has taken this initiative specifically to make their legacy and see how they can take their resources and impact a broad scale throughout Minnesota to see how other counties. So as I mentioned, Meeker County they did an individual application themselves, and they will be moving forward with their Explore and Assess. Region 6W, which is Chippewa, Yellow Medicine, Swift County, Lackaparle, and Big Stone, is also going through their Explore and Assess at the same time. So when we were looking at partners, it was important to us as leaders within these areas to say, how could we also learn from each other through this? But we'll also, through this process, be put in a community of practice through the Sauer Family Foundation with existing FRCs, as well as exploring FRCs to learn from each other on an ongoing basis, to see what's working well in your project, what's working well in your implemented project that we could learn from and explore as a potential for us. So it's really not, the hope in the broad scheme is to not add additional levy, it's just to pivot and hopefully decrease, because we're creating opportunities for individuals to thrive without our engagement is the ultimate goal. But also the other benefit is that conversation that you have with your constituent about their needs. It's creating a low barrier front door option for them to engage and know where to go for their needs. Often people don't want to come to the front door of Health and Human Services because they don't feel they qualify, they don't feel it's for them, they feel it's services for other people. But really what it is, it's a door to create other doors to UCAP, who provides housing, heat assistance, if the grants are available, or plugging them into other service and service coordination. I don't believe that Candy-Ojai County at this point has the desire to hold this project long-term, but if we can help move this project forward as a county partner, maybe another entity could be the holder of it. That will be your decision following the information that we get.
I'm glad you brought that up, because they actually use the word navigator in the article. But when as you finish, you talk about maybe another partner would be operating this rather than the county. And I know we're a long ways away from that, but do you have an example of what that might look like?
An example to me is right now, a lot of the work that our partners at United Community Action Partnership, that they do, really kind of emulate some FRC work, but then they have Woodland Centers operating in a different area that also kind of emulate some of FRC work, and how can we bring that as well as Safe Avenues? So having those partners at the table as we move through this process will be important, but it could possibly blossom something in a way that our community begins to work together differently, because we all have our areas of focus and our mission. And so again, as the conduit and the convener, which is where we come in, we are hopeful to help bring these partners together as we explore our community needs.
All right, thank you.
Commissioner Dale Anderson.
Well, Caroline, you answered a lot of my questions in the last couple of seconds here, but I guess I just wanted to reiterate what you've said. You know, I'm glad that you guys are being proactive in doing the research part of this. We aren't just going out and building some facility or doing some program without really knowing where it's coming from. I think it's great that you're doing that initiative to find out what people are really looking for and see what our community is really needing before you just go out and do something, you know, without knowing what people are really thinking. So I think that's kind of the cool part about it. But I definitely think there is a need for something like this. And hopefully, like you just said, that all these agencies can kind of come together and become maybe one new group or something new. So I know I said it at our training, but that we just were at for AMC, but you know, change sometimes is really great. And I think sometimes you have to embrace that change and we come with a better product at the end. So thank you.
Thank you.
And Commissioner Burke.
Thank you, Mr. Chair. This is pretty exciting. I've been a little bit involved with this already, and I think it has really a lot of potential. And I see some of the potential being that there's a preventive piece of this as well, to get to people and help with navigation of problems early on before they come out here and apply formally for some services, for example. And so that's really exciting too. And I think as you were saying, I hear you saying, I'm repeating this to be clear, is that once it gets up and running, we're not going to be creating a much new staff or anything from that point of view, other than there maybe has to be one key person who coordinates this and moves forward. But there's so many different kind of plans out there for family resource centers. I kind of think of YMCA's used to have the saying, you've seen one YMCA, you've just seen one YMCA, and that'd be true with this. We'll develop our own here as we go forward if this works and fits. I'm really concerned though about that last part of the whole plan then, and if it does look like we move forward, there's going to be a crunch time to look at some of the financial things, because there are going to be costs in reference to where would it be with, like Scott County had a place. This worked out really well, a good place they did to develop the program. But we need that, and we maybe need a coordinator that would schedule things for these things going through. And that's pretty much what you said. Am I understanding that?
Yeah, so yes, I'm going to repeat back what I heard just to be sure that I'm clear. So during this process of 9 months, we will have a staff dedicated as a coordinator and task them with that, and their wages
Oh, you
will
will?
be covered
Okay.
through the grant. Following that, it's our responsibility to bring the best information we can to this team to help make our decisions and formalize our process after that. I think we need to be open that it could not be brick and mortar. It could be electronic. It could be all sorts of different ways that it could look for Candy, Ojai County. So it could involve a coordinator, it could involve 10 coordinators. I don't know. My job is to bring the information
Okay.
and explore our community with our partners over the next 9 months and bring that forward to the 5 of you for further evaluation, and along that process, engage you so you can provide some direction and pivots as needed, so.
Very good.
May I just follow up
Yeah,
with a quick
yeah.
question?
Go ahead, and then
Going back, is this similar to the grant then like Scott County got?
It's the same grant.
It is the same grant?
It is.
So it is the, okay.
Yep,
Oh.
same Sauer family.
So that helps me
Yeah,
understand
and they
this.
provide an infrastructure of support through this
Yes.
process too, because they want to see their grantees be successful.
Perfect, perfect.
All right, if we have any other further questions, reach out to Caroline and her staff moving forward. But thank you for the presentation. Appreciate that. Knowing that we have a little bit of a time crunch and some folks have to get out on the road, I'm going to move 2 items around real quick. Heidi Roundhorst with Hawk Creek Watershed Project update. We'll have you on, and then we'll move Administrator Baker's presentation to the end. Is that all right with everybody?
Could we,
Mel stuff
we
too.
approved the agenda kind of as we did, could we do the Middle Fork appointment?
I'm looking at the weather outside, and I know that you and Commissioner Dale Anderson have to get going, so. All right. Heidi, welcome.
Yes, thank you. Thank you for your time today. Can we get I have a presentation if we can get that up there. Yes, so thank you for your time today. I just wanted to come and give you an update of the Hawk Creek Watershed Project. Yeah, so just a refresher of our background. So Hawk Creek has been around for almost 30 years. We are a joint powers agreement between Chippewa, Candy, Ojai, and Renville counties. And so we have one county commissioner from each county that serves on our board. So we have Commissioner Berg, and we also have, from Chippewa County, we have Commissioner Kurt Strandberg, and then from Renville County, we have Commissioner David Hamry. In the Hawk Creek Water, can you hear me all right? I feel like I'm
Yes,
a little
you're
quiet.
great.
Just don't want to shout. Originally when Hawk Creek was created, the purpose was to have a local voice, to have local control over water quality efforts, and then also to work on that watershed scale. Because as we all know, water doesn't end at political or county lines. So working on that watershed scale is important. So historically, our primary funding has come from federal dollars from the EPA. Specifically, their Section 319 funds. Section 319 refers to the Clean Water Act. So historically, most of our funding has come from federal dollars that we've been able to bring in. Some of our funds have also come from clean water funds, which are state funds. Most of those funds we've used for our monitoring that we do, and then some for projects and other things. But most of that funding has gone towards monitoring. And then miscellaneous contracts. We have several miscellaneous contracts that we have. Currently, we have one with the Minnesota Department of Ag, one with Discovery Farms Minnesota, and then one with the Central Minnesota River Watershed Partnership. So future funding, as of right now, can we go back one? Where there's, am I missing one? Oh, I missed one. That's on me, sorry. History of funding, sorry about that. Can you go? Thank you. So we've brought in close to $18 million to date into our local economies. About $10 million has been in grant funds, and close to $8 million has been in those low-interest septic loan funds. So looking forward into the future, we have about $1.5 million encumbered as of today. Most of those funds encumbered are those federal $319. And if you look at that map on the right-hand side, that's the grant work area. So you can see a lot of those $319 funds will be spent in Candy Ojai County over the next 10 plus years. And we also have monitoring funds that are encumbered. So we do have 1.5 as of today. I do expect more as more opportunities come. You know, I don't know what's going to be available in a year or two. You know, you don't even have the opportunity at that point. But as of today, I can say at least 1.5 million. So just a refresher of what the Hawk Creek boundaries are according to our joint powers agreement. It's Chippewa, Candy Ojai, and Renville. So Chippewa County is about 27%, Candy Ojai is 26%, and Renville County is 47%. And then if we flip that around and we look specifically just at Candy Ojai County, the Hawk Creek watershed makes up about 30% of Candy Ojai County. So the Hawk Creek watershed is your largest watershed in the county. But our work area actually expands beyond just the boundaries. We work actually in quite a large area. We actually do work in 4 different watersheds and in 6 different counties. So when people ask me, well, what do you do? What do you guys, you know, your Hawk Creek, what do you do? You know, I could go on for hours talking about all the different projects and all the people we work with, but to really simplify it, you know, 3 main components. We do water quality monitoring, we do projects, those on-the-ground projects, we call them best management practices or BMPs, and then education and outreach. So I just wanted to touch base on those 3 things. First is the water quality monitoring. The main monitoring that we do is with MPCA, and that's with their pollutant load monitoring network. We have 6 sites with them doing that. And the point of this type of monitoring is to get long-term data. So a lot of these sites we've monitored for several years, and the plan is to continue to monitor them for several years moving forward. We also, with MPCA, the Hawk Creek is the lead for their RAPS, which refers to Watershed Restoration and Protection Strategies. And this is part of MPCA's watershed approach. And so what happens in the watershed approach is every 10 years, every watershed in the state gets assessed. So the Hawk Creek watershed, the first year that they went through its RAP cycle was in 2010, and then we started the second cycle in 2020. So every 10 years, we do intensive monitoring. We have several more water quality monitoring sites. We look at biological assessments, so just a lot more intensive assessment of the watershed so we can get a lot more data. So Hawk Creek is the lead for the RAPS. So we collect, like I said, we collected data in 2010 and then in 2020. And the data from the RAPS is really important because a lot of that data gets used in your county, your One Watershed, One plans, your local county plans, and then also to apply for grant funds. So a lot of entities, Hawk Creek, but also your SWCDs, some of your county departments will use that data to then, show that, yes, we do have some pollutant issues or some impairment issues, and then we can apply for grant funds and then get those funds to do work here locally. So we are doing some monitoring through the RAPS, but it's not in the Hawk Creek watershed right now. It's in the middle Minnesota, so in southern Renville County. We have 2 sites there, so we monitored those 2 sites last year, and then we'll monitor again this year. But for the Hawk Creek watershed, the RAPS monitoring that we did, here you can see all those red dots on the map. That was just what we did in 2020 and 2021. We had 22 sites, so 7 lakes and 15 streams, and that's on top of all of the other monitoring we do, so that's additional monitoring. In 2010 and 2011, which was that first RAP cycle, we had 12 lakes and 65 streams. So it can get pretty intensive, the monitoring that we're doing and the data collection. We do have a site with EPA, so this site is on Hawk Creek near Priam. And so it's a new site, but it's also an old site. So it's new because we are going to start monitoring it here in 2025 using those federal 319 funds. I was approved to do some monitoring using those funds, but this is a site that we had monitored several years back, and we stopped monitoring it in 2012. We were monitoring it through MPCA, and then MPCA changed up their network and some of their locations and parameters, so this was a site that got cut in 2012. And I've always thought that this was an important site because it's in the upper reaches of the watershed. Otherwise, our most northern or upper reach that we monitor is Hawk Creek near Maynard. So that's already halfway through the watershed. So we need to be looking at what's going on throughout the whole watershed, and those upper reaches are important. So I asked if we could get this Hawk Creek near Priam site back, and the plan is that we should be able to monitor this site for several years moving forward. And then we also work with the Minnesota Department of Ag, and that monitoring is specifically pesticide monitoring. So we have 4 sites there that we monitor. And then we also work with Discovery Farms Minnesota. That's looking at field scale data collection. So we collect water quality samples right off of a field, whether it's subsurface tile or surface runoff. We have 1 site there now, but that fluctuates from year to year. We have some years where we have 10 to 20 sites, just depending on if they have, landowners that want to work with them and what the situation is and what parameters they're looking at. So we have 1 site currently with Discovery Farms. So here's a summary for 2025. So we have 12 sites that we'll be monitoring, and those are spread out over 4 different watersheds in 6 different counties and working with 4 different entities. So it's a lot of moving parts with the monitoring. So that's just for 2025. Every year it fluctuates. So some years we have double or triple that. So just in summary, I just really want to make the point that we do have a long history of monitoring, of extensive monitoring, not only in the Hawk Creek watershed, but several other watersheds as well. And then that data that we collect is necessary for multiple entities to be able to then apply for grant funds and get those funds to do work in our local area. And then future water quality monitoring sites, there is another pot of those federal 319 dollars that I'm hoping that I can tap into. There's a few lakes that I'd like to do some monitoring on. So I'm working with MPCA and EPA to see if we can get some of those dollars and do some long-term monitoring on some lakes. So we've collected all this data. I just want to give you a really quick summary of just a snapshot of what we see with all this data that we collect. Basically, we do have water quality issues throughout the entire watershed. If we look at total suspended solids, which is basically how much soil or debris is in our water, and usually it's a good indicator of how much erosion is happening on the landscape. If we look at our 3 sites that we monitor in the Hawk Creek watershed, so Hawk Creek near Maynard, Hawk Creek near Granite Falls, so right before it goes into the Minnesota River, and then Beaver Creek near Beaver Falls, so just north of Redwood Falls. All 3 of those locations, or those subwatersheds, are in that purple color, so in that highest tier level. So we do have some pretty high total suspended solids in the watershed. And we can say the same thing for total phosphorus. It's kind of a copy and paste on total phosphorus. We do have very high levels of total phosphorus. In some cases for both the TSS and phosphorus, we have 1.5 to over 2 times higher than the criteria. So very high levels. Nitrogen, we have high levels there as well. We're in that highest tier to second highest tier. So we do definitely have some pollutant issues in the watershed. And this leads us to, we have lots of impairments because of the data we collected and then from the pollutant levels. So every 2 years, MPCA puts out an impaired waters list. The latest one came out in 2024. And so you can see the map on the right-hand side, that's the Hawk Creek watershed. And everything in red is an impaired water body. So we have several impairments throughout the entire watershed. If we look at Minnesota, we have over 6,000 impairments in over 2,000 water bodies. If we look at the Hawk Creek watershed, we have 119 impairments in 45 water bodies. And then if we look specifically at the Candy-Ojai County portion of the Hawk Creek watershed, we have 28 impairments in 19 water bodies. So several impairments, several water bodies that need some work.
Heidi, if we can, I know that, and I apologize, we're up against a little bit of a time crunch here, but can you maybe just pick out a couple of the, for example, a couple of the projects,
Sure.
EMPs, and then go into the kind of wrap this up for us?
Yeah, yep, I'll speed it up.
Apologize. What's it? Oh, okay.
Could
Commissioner.
you go back one slide? So the impairments are those heavy red areas up in the upper right?
Yes, those are the lakes that are impaired.
Thank you.
Yep, if you, I do have the lakes if you want the lakes at all. But, yeah, so we can go into some projects. Yeah. We can keep scrolling, there we go. Yeah, we can keep scrolling, there we go. I just want to highlight in Candy-Ojai County, we've done 624 projects, and that was working with 417 landowners. And landowners can be, an individual, Candy-Ojai County, nonprofit, all sorts of groups like that. I did want to highlight this project. This was working with the Candy-Ojai County Drainage Department. This was a washout that was occurring at the beginning of a drainage or a county ditch. So here's the washout and the erosion that was happening. So we were able to go in and put a drop inlet in there, vegetate it to help stabilize it, and then put a trash guard on there. So yeah, we can just go through these pictures real quick. Basically, in a nutshell, we've done a lot with not only the ag land in Candy-Ojai County, but a lot with the lakeshore residents. A lot of the projects that I've shown you here are on the lakes, but ag land, shoreline restorations, lakes. So we work with anybody who has an erosion issue. So we'll skip past all that. Let's see. Yeah, and then we can go to our third component, which is just education outreach. We do all sorts of stuff. Meetings, we have annual meetings we've been doing for 23 years. We've done meetings on all sorts of different topics, soil health, aquatic invasive species, egg waste, all sorts of things. Field days, we've been doing field days pretty much since we started. Most recently, we've been focusing field days on soil health. So we've been demonstrating different reduced tillage practices, cover crop test plots. So it's a great way for people to get out there and visually see what a difference that soil health can make. Youth events, we do youth events all the time. This is a picture of Jordan, who's our water quality outreach technician. He's using our stream table, which is a great tool that we use. It helps show kids how water moves and how erosion happens and pollutants move throughout the system. So we're actually set up to work on, or to be a part of the Healthy Earth, Healthy Kids event at the YMCA later this month. So that'll be, I think, a really great event. Newsletters, we do a newsletter every year. We send that out to about 15,000 watershed households. So hopefully most people get a chance to get something in their hand to see what we do and what resources that we have available. We do have a citizen monitoring network. We have about 30 volunteers that collect some precipitation and stream and lake clarity with us. This slide, I'll let you read through that, but just I wanted to give some specifics in Candy-Ojai County, what we've done. And partners, I wasn't gonna go through this one anyway, but I just started typing out all the partners. It was just to highlight that we work with a lot of different people, all the way down from the individual landowner to counties, county departments, SWCDs, state, federal, lots of nonprofits, local businesses, all of that. So just to really highlight that, our reach is really far. We collaborate with a lot of different groups and people and a lot of great partnerships to get a lot of great work on the ground. So there. thank you.
Thank you so much, and again, I apologize
No,
for.
no worries. I'm looking out the window
cutting you-
too,
cutting you
so I'm a little nervous.
You'll probably
Yeah.
have to come me short. Thank you. And Heidi, I'd like to thank you. This is a very interesting presentation, different than what we see on the board generally. We know the details of this, but a couple of things that really quick, and try and make this as short as possible, is one question I had is about the monitoring. If Hot Creek Project didn't do the monitoring, who would be doing that monitoring? And it's a lot more complicated than just say, yeah, we monitor this. There's a lot of details that go into this. And also, I just want to recognize the commissioners 28 years ago that developed this joint powers to treat the watershed as one watershed plan, in a sense, to a large degree. But these are important services, and I also want to point out that I believe there's been very little county dollars involved, other than maybe initially setting this up. And basically, all the grants that you've been able to obtain, almost $18 million going forward. Now, we know the economy and everything else is starting to slow down, and there's a concern about that as we go forward. But I just wanted to bring those things up.
Commissioner Dale Anderson.
Yeah, thank you. This is great. I did look at this quite a bit, getting ready for the meeting, but I think, you know, the big thing that we have to look at, and I'm on the Chippewa Watershed Board up there, I mean, our water quality is really starting to get to be a serious issue. So I think the more that these organizations can be involved and be part of this, that's very important. I mean, there's getting to be a lot of concern about our lake qualities and for entertainment purposes and for everything else. So I think that we have to really stay active in these different organizations to be doing our part to make sure our water quality is kept as good as we can, because we do have a lot of impaired things like you showed, and I think that's got to be addressed, and maybe there's going to have to be some way to spend or to do something to try and help with these issues, because it's going to get serious, I think.
All right, anything else from the board for Heidi?
I
Commissioner?
would just say that it already is serious. It's not going to get serious. It already is serious.
Understood. Again, Heidi, thank you so much, and I promise the next time we have you back, we'll give you all the time
All
that
right,
that
great.
you need for this. And hopefully our friends in the media over there can help you out with getting your message out as well.
All right, thank you. I appreciate that. All right,
And-
thank you for your time.
And thank you for yours. Thank you so much.
All right.
We'll move on. Mel Odens, Public Works Director, you have 2 action items for us?
About the appointment of the watershed.
I moved that down to the end. Would you prefer that we take that now?
Yeah, I think.
Is that of concern for you in your district? I apologize, and we'll take care of that right now.
Good morning, Kelsey Baker, Candioi County Administrator. Before you today, we have the appointment for Middle Fork Crow River Watershed, board member, not district manager position, but we did have to post it. And the post was published the week of March 5th and the March 12th. We received 1 letter, which is attached in your board packet, for Ruth Schaefer. As you can, I'm not going to read the letter. My recommendation, because we received this one, I've had conversations with Ruth. She is currently the board chair. My recommendation would be to approve the appointment.
You've heard the recommendation,
Mr.
Commissioner
Chair,
Reddick?
I'd move on, appoint you, Ms. Schaefer.
Is there a second?
I'll second it.
Thank you very much. Any discussion?
I just would add that I did have a conversation with Ruth actually it was Sunday, and again, she reaffirmed her interest, and she's been very, very dedicated to the Middle Fork watershed she was there when I became a commissioner 12 years ago, over 12 years ago, so she's an asset to that organization.
Outstanding. Anybody else? All right, we have a motion and a second to approve the appointment of Ruth Schaefer for the Middle Fork Crow River Watershed District Manager position. All in favor, say aye.
Aye.
Aye. All opposed? Motion carries. Thank you. Mel?
Mr. Chair, members of the, excuse me, members of the board, Mel Odens, County Engineer. I've got 3 items that I would like to bring before you. The first one is a bid award for Project 34-090-005. It's a concrete trail in Spicer. It extends from County Road 8 westerly to Beach Street. It's going to be a concrete trail, and then what we will do from Beach Street as you go into town all the way up to the Dairy Queen corner, if you will, the Legion, we would do ADA improvements. So they would have ADA all the way up to the Dairy Queen corner. So we received bids on March 25. We had, I believe there was 4 bidders, and Ashwell Companies of Cokato was red low. We've reviewed the bid, and they meet all the requirements, so they were well under the bid. And this is funded through Transportation Alternatives Grant, through state aid, and then a little bit of local levy for the match. It is my recommendation to award the bid SP 34-090-005 to Asheville Companies of Cokato, Minnesota in the amount of $297,744.89.
You've heard the recommendation of staff.
Move,
Is there a
Mr.
motion?
Chair.
Thank you, Commissioner Imdak. The chair will second. Any discussion? Good bid result here on this. The engineer's estimate was considerably more.
Very good bid. You know, what we're seeing is, and we've seen it in the other bids, is concrete has really come down in the last year, which is good, but we didn't see that coming, so.
Understood. All right, anybody else? All in favor of the motion signify by saying aye.
Aye.
All opposed? Motion carries. Thank you. And
Thanks,
then
Mr. Chair.
one
Now,
more action item.
speaking of coming down, the bid prices for bituminous are at a low of 7 years ago. And even before that was 2013. But we received 2 bids for this year's bituminous project, which is the large part of we're doing 31 miles, 130,000 ton. This is considerably under our estimate, but our estimate was based on bid prices from last year and the year before, and we do a 3% cost of consumer price index increase, but for us, fortunately, it went the other way. So we received 2 bids, Central Specialties and Dunix. Incidentally, those 2 bidders were very close, and so we feel good about the bids, but the recommendation is to award the bid SP 34-602-043 to Central Specialties of Alexandria, Minnesota in the amount of $9,779,722.06.
You've heard the recommendation of staff. Is there a motion?
I'll move.
Commissioner Dale Anderson moves. Is there a second?
I'll second that, Mr. Chair.
Commissioner Dwayne Anderson seconds. Any discussion? Almost 19% under.
Right,
bid,
yeah,
and
and that's,
represents $2.2 million, so
yeah.
this is good news.
Yeah, and some of the main parts ironically were on one of the main ones on County Road 4. Other than that was, so it's a state aid savings, but it's a savings for all of us because like the landfill got good prices along with some.
Thank you, Mr. Chair. I think this is probably some of the lowest bids that come in since I've been on the board. And now you set a precedent, so we were expecting. No, but good news, we hope it keeps going
Yeah.
that way.
So,
Makes
you
it
know,
easy to vote on.
the good part of it might be, this might be an over expectation, but we have 130,000 ton this year, and normally we run about 80,000. But when we're in this short-staffed and we're doing this preventative maintenance preservation mode, you could put a lot of bituminous on the road without having a lot of staff time. And so, yes, this is a big year, and they can just get the plant running and get the trucks. If they start every morning, they can just keep hauling and we can just keep laying her down. So, but it does come with a lot of money and it does come with maybe some better prices because you have a lot of volume that they can put.
All right, very good. Commissioner Imdak.
I understand our townships and cities have an opportunity to take part in this bituminous bid. Did we have any of that?
Yeah, we had, well, let me think about, let me think about what, if we had a bituminous, we had, no, we just had the landfill. No, we did not have a township. The main projects, with that being said, is the Tri-County Road is the one, you know, the joint project with local option sales tax. And then we're doing some City of Wilmer stuff, College Road, 7th Street, that's good because that helps all our entities there. And then the other big one is the unofficial detours of County Road 31 going into New London. And so we're gonna, in essence, all the way up to Howick, you know, including County Road 2, we're gonna be milling and overlaying, in some cases, you know, patching and doing some extensive work on both 31 and 2, so.
Outstanding. All right, we haven't voted yet, correct? All right, are we ready to vote?
Yes.
All right, all those in favor of the bid award signify by saying aye.
Aye.
All opposed? Motion carries, thank you. You have one last item for us, Mel. This is an informational item on
Yes.
BNSF corridor. Before you get to that, I know that a couple of you have to go. The weather is getting kind of crummy out. Please feel free to excuse yourself as needed. Mel, go ahead.
I can make this somewhat quick. The administrator and I have been working a little bit with the City of Wilmer, and in fact, this almost started 2 years ago for me. When the Wilmer Y opened and they knew that they were doing less volume of train traffic in the downtown area, Burlington Northern approached both entities about should we do a corridor study through, primarily back then was through the limits of Wilmer. And then I said, well, if the county's gonna be involved, we have Lakeland Drive with the what do you wanna call it, rescue building?
Rescue squad.
And then we have County Road 5, and then we have 7th Street, you know, in the downtown area. But more importantly for the county, you know, we have a lot of crossings up and down 23, you know, our county roads, and then on 12 the whole way. So I wanted to include some of those. We had no idea how we would go about it. We just thought, well, maybe since we're so active in your county, we should just do an overall corridor study, like it would help rank our projects. And then this was all in the spirit of the federal funds, you know, the IIJA funds, about, you know, we were successful in getting the rail crossing elimination grant for $4.8 million. We thought, well, maybe, you know, if we have some projects on the table that everybody agrees, the county, the city, the railroad, the public, if there's a grant, we can submit. We don't have to go through like this development process. So that was the original reason why we even talked. And then we didn't talk for almost 2 years because of a variety of things. And then here a month or two ago, the railroad reached out and said, hey, maybe we should reinitiate this discussion because we're kind of wrapping up now the Y and the Southwest Bridge. And so I did have a meeting with the city, some city staff, about like, what would this look like if we did a corridor study? And so then Burlington Northern took the initiative to do kind of a draft agreement. Now, the draft agreement does state some dollars in there if you happen to see, so it's not cheap. And so what, you know, we decided to do is maybe roll this out to the board to say, is this something that you'd want to entertain doing? I think the city is going to roll it out to the city council because it would be a project that would involve the public. It would involve open houses. It would involve, the benefit of it is that you would have an idea. You would be very intentional about your plan. You would have, it would not be a surprise if they, you know, like, if you had come up with a project, it would be something that both boards and the railroad and the public endorsed. So was the reason. So my bringing it to you is maybe like a head nod of, is this something that we should continue? My recommendation to the board would be to continue it, and it would be a 2-year planning. And I would include it in my 5-year road and bridge plan. And for me, it would actually save me money because Burlington Northern kind of, just like our roads, they have their crossings, they spring it on you. You know what I mean? Like, hey, we got to do County Road, like County Road 1 next year, or no, this year, and then we're doing Raymond this year because Highway 23 is going to be closed. You know, because they're doing County Road 1. So, you know, those are, the Raymond one's 160,000 and the County Road 1 I think is 40 or 50,000. So the dollar amount for me, it'd be better for me to know a plan. Like very intentional plan of like, what are you thinking so I can include it in my work? So for me, I think this is my recommendation to the board. We would continue to do this, but we would continue to do it also for our interactions with the city of Wilmer.
Commissioner Emdick.
We all know that anymore today, when grant opportunities do become available, it's helpful to have a plan on the shelf, even if it's a couple years old. So I know we're not taking action on this today, but you're asking for a head nod. I need to walk out the door. So
I know you do.
I'm going to give it my head nod on this one. Thank you, and I apologize for having to bull.
No apology needed at all. Wayne, any?
No, I just think this is a good thing to do.
I'm just going to say that, you know, I know that MnDOT is looking at upgrades to that Highway 12 bypass in downtown Wilmer, and part of that involves the potential closure of one or both of those crossings at 7th and 10th Street Southwest.
Yep.
And so that's, I think this is exceptionally timely, and I would certainly lend my support to it. I think I saw a couple of other head nods down here too.
Absolutely.
So.
It's crucial, I think, is some of our districts that it supports, we got to move forward with some good plans.
You know, and I think it's a little bit, for me, it's like the Wilmer Y. It was a dramatic step to take to endorse the Wilmer Y, but look what it's done with the vision that the county board had back then with the Westerly bypass. We had an interchange, we got ramps. I mean, we got opened up with the Class 1 railroad to an industrial park. Never would have happened had we not taken that back then large step, which we probably didn't even realize was a large step back then. So this might help us with Lakeland, it might help us with 7th Street, it might help with this County Road 5, and all the things within the city for sure, and then, you know, for the county outside the city as well, so.
Okay. I think you have the full consensus of the board to
Thank you.
continue this
We
work.
will.
And looking forward to that.
And, yeah.
Thank you so much. Anything that I've missed prior to administrative updates, calendars, committee reports? Good. So then I would just ask the administrator if she has any updates for us today.
Just a few. So at the April 15th board meeting, we're gonna just kind of try wrap up that board operating guidelines and procedures. And so I've talked with the board chair, and we're just gonna have that at the end of the meeting. Not necessarily call it a work session, but include it in the board meeting to have the discussion and then hopefully approve it at the following meeting. I've moved and talked with the financial staff for the May 6th board meeting, so we'll probably have a work session after that board meeting to go over the first quarter financial report. We'll hopefully do that 2024 recap, and then we'll kind of look at where I'm envisioning kind of the 2026 budget. And then just a reminder, for this Friday is Student Government Day. I just want to do a little shout out for Melissa Keisner. She's done a lot of work with this, with coordinating with the schools and the staff, and all of you commissioners are invited for the lunch. We'll have about 25 students that will be with us during the day, and kudos to all the staff that have kind of helped make this possible, and hopefully this is just our first year.
You want a commitment from us now, or who's going to be there?
Doesn't matter. If you show up, you show up. It's
Okay,
great.
good.
Yep. And then just on April 22nd, the strategic planning session. And the other thing I just wanted to say, which I think is really exciting from my point of view, it's not only just what Mel Odens was talking about with this planning process with BNSF, but it's also what Caroline Kahn is doing with the Family Resource Center. And, you know, difference with I mean, it's around the same dollar amounts, grant levy, but still it's the planning process. And I think that's where sometimes counties don't go after that initiative and are proactive in that. And so the work that each department is doing in planning to set us up for the future is really cool to see. And I'm proud to be a part of the team.
Outstanding. Thank you for that, and looking forward to Friday with the students coming in over here, and looking forward to taking part in the panel discussion as well. So, does anybody have any appointments pending yet? No, okay. Then we are down to committee reports. Commissioner Dwayne Anderson.
Okay. So since our last board meeting, I had, I think 6, I wrote down here, meetings. One was that Road and Bridge meeting that we had with Mel, with Public Works on the 18th, and then we were all there, so that's pretty much a routine one. I don't need to report on that. Then on the 20th, I had Pioneer Land Library System meeting, basically a routine one. That was with Commissioner Dale Anderson as well. Then on the 26th, I had the Armors meeting, that's Emergency Services Board. They're still working on a lot of things. One is getting ready for NG 911 to be prepared for that, and kind of get all the equipment and stuff statewide, I guess would be, but in our region especially, because that's who the meeting was about. It's to get it that way, which is to go from analog devices to digital. And that's gonna be quite a process, because we have a lot of different towers and equipment and dispatch centers that need to be get on board and to get updated with their equipment. So I think Kaneohe County is pretty well situated for that, but there's some areas that need to get a little push to get them moving along. And on the 27th, I met with some of the county employees with the Employee Wellness Committee. That was kind of interesting, and it was basically just how to get the county employees keep active and do little different things with eating healthier and keeping people moving, so that we kind of can help with our I suppose it would be our health insurance overall, yeah. So that was kind of interesting to go to. I also had a UCAP meeting, that was Zoom, basically a routine meeting. They were talking about our development on for like apartments or whatever for people that need a little help, that end up being maybe homeless for a little period, and to get them back on their feet. That's moving along quite well here in Wilmer, and I'm kind of glad that they got that, and they got quite a big grant for that. It paid for the whole thing, basically. So, and then we had our County Township Association meeting with the townships yesterday, and basically all of us were there, I think, or maybe 4 of us. So that was kind of interesting as well. That's my report.
Thank you, Commissioner Dale Anderson.
Sure, I can go. So like Dwayne said, we had a road and bridge meeting. After that, I went to the soil and water conservation meeting. And that was the one thing I was gonna bring up, and I could have brought it up during the Hot Creek thing, is a lot of people around this area have had major shoreline destruction from all the ice heaves and everything. And please go and talk to your soil and water conservation. They've got a definitely good program that can help out restore some of them shoreline destruction that was done from the ice. So take time and give them a call. I actually brought that up to a couple people, and I even got emails back thanking me because they didn't realize that was available. So if you have shoreline problems, give them guys a call. It's a big deal for this year. Everybody seems like they've got their shoreline has been heaved up. So that was the one thing there. I went to the library meeting with Dwayne, like he said, on the 20th. And then I was at a leadership training for AMC from the 26th through the 28th. And probably the best leadership training I think we've ever had. Very, very interesting. It was the thing that I took out of it that really makes me still kind of chuckle is we all have our cell phones and we're all watching emails, and we all got our computers. And a lot of times at these meetings, you see people sitting with their iPads open or they're sitting on their phone. And there was only one time where everybody kind of at the last day, everybody was kind of going, I've got to get checking some of these emails. So, and he actually called everybody out on it. And it was instantly put away and everybody was so engaged. It was almost funny to watch how people were not half sleeping and not half, doing other business. So it was really kind of an interesting deal that I haven't seen in a long time. Normally you go to meetings, everybody's always doing other work. So he was very good. It was actually a guy from Albany that did the whole project. And I felt it was probably one of the best one we've had. So I learned a lot and really appreciate that I was able to go and take part in that. Other than that, I did not make it to the township meeting, but I heard it was a good meeting. So that's all I have.
Commissioner Berg.
Thank you, Mr. Chair. After the last board meeting, I had a meeting, an intergovernmental agency meeting with the schools and Commissioner Gardner there, and of course, Administrator Baker was there, as well as the City of Willmar staff, and had a very good discussion. We talked about how can we possibly collaborate more on different projects and informing each other what's taking place and happening. And also talked about dollars and budgets, so forth. I had a Prairie Lakes Youth Program, and things are moving forward with that. Unfortunately, the big plans we had that we'd be moved in by now into the new facility, and there's more to it as we go along, of course. And we're still waiting for licensing from the Department of Corrections as well, since it's a new facility. And other aspects as well. So, but we hope to be in there in a couple months. So, and looking at other grants and still trying to keep an eye on everything as we go through this year. Had a Woodland Centers meeting, and we've had the update on that. We did spend a lot of time talking about finances and budgeting and the services and the cost for the services, and trying to look at as many options as possible to make everything work and continue to provide as many services as possible to the hundreds or thousands of people that they serve each year. I had Friday, myself, Commissioner Gardner, maybe you can talk more about that, as well as Commissioner MDEC, an EDC meeting, and that took up the whole day, and hiring the new staff person there. I had attended online the AMC legislative update on last Monday, or on the 24th, as well as I attended on this past Saturday the legislative update from our local representatives for our state legislative group. And it was very good discussion we had there, very good. It's tough. It's going to be a financial tough thing going forward. And everybody, this is the first time I ever heard so much talk about, hey, we got to work together across party lines. We got to, make this work together. And we're at this point now. So I'm feeling really positive of that. And the township meeting, and I'm done.
All right, thank you. I'll try to be brief. Again, attended the intergovernmental meeting with Administrator Baker and Commissioner Berg as well. I think there's some potential opportunities there to work together a little more closely. And I think that's going to be something that's going to be highly important moving forward, especially with the turmoil in Washington and St. Paul as it relates to opportunities for cities, counties, and school districts. Like the stock market, these entities like stability. We crave stability in our operations, and so there's some major concerns at both levels that we as counties will have, and our cities and school districts as well. So looking forward to those continued conversations and potential collaborations. The KCED, Candida County Economic Development, which is a joint powers with Candida County and the City of Willmar, did hire a new executive director. She has accepted. Barbara Carr will be onboarding beginning April 16th. and we're looking forward to having her. Barbara is a native of Minnesota, has a former executive director position that she held in Aiken County with Aiken County Growth, and has continued to work within economic development field. And we're looking forward to having her on board. I want to also give a shout out to Michelle Moratsky, who has been our interim director during this time, and she also serves as our business development manager. Michelle does phenomenal work for us, and I just don't want that to go unrecognized. And you know, she's been doing a lot of work now, and she'll continue to bring that forward. And we're looking forward to seeing what KCED can do for us in the future.
And thanks for bringing that up, and I'd like to echo.
And I too attended the AMC Leadership Summit. Scott Welly is the presenter. He's a native of Albany and does really, really solid work. What I enjoyed most about this were, again, the accountability that he demanded from us. But he had a room full of folks, both commissioners and staff members from various counties. And everything that he gave us were things that we could work on now that are going to be relatively easily implemented. And not just for ourselves as individuals, but for ourselves as groups. And I'm so highly impressed with that. And that was, like Dale said, that was the most impactful leadership training that I'd been able to be a part of. And so really looking forward to continuing that work as well. And hopefully we can bring some of this to our organizations here as well. And two other items. On Friday, of course, we have the Student Government Day here, and looking forward to participating in that. And Thursday morning is the local chamber is holding their annual leadership banquet, and Michelle Moratsky is one of the award recipients, as well as our administrator, Kelsey Baker, is an award recipient as well, and looking forward to attending that. I know Commissioner Berg is doing that as well, and just wanted to say to you, congratulations. You received multiple nominations across that, and looking forward to seeing you recognized on Thursday.
Thank you.
That's all I have. Does anyone else have anything for the good of the order?
Just a reminder, I think Water and Soil is having our open house today.
Yes.
And if everybody wants to go in the bad weather, they would love to have you come.
And if I remember correctly, that is, well, I don't remember correctly. That is from like, well, now until 4?
10 to 4.
10 to 4. Okay. Sounds good. Well, we'll try to make that work. Everybody, watch the weather, drive safe, and we've concluded our business, and so the Candidates County Board of Commissioners is adjourned.